Recording in progress.
Hey, Kelly, I'm here. If you want to give me co-host rights, I can help with whatever.
Okay, sounds good. I think I gave them to you, so just check.
Yep.
Okay, sounds good.
If you want to make me host so I can help others get the permissions, you can do that. Otherwise, you might have to do that.
Check to see if you can, because I found, sorry,
Yeah.
I'm going to talk everyone about, so I found on my settings is that I could give the co-host permissions to do everything that the host can do. And I selected it. So I wanted to try that. So maybe see if, I'm going to remove Sylvia's and see if you can give Sylvia
Okay.
permission to.
Yeah, I can. Allowed to record local files. Yeah. Okay.
Sounds good. So I will show you that little button today. I did, or later. Okay.
Sounds good.
Thanks. I did hear from Dr. Sampath Kumar, and she might be a few minutes late. She had something up against this, so just bear with us as we wait for her to join. But I think we do have most media on, so I can just go through some. Oh, sorry, give me just a second here. I saw your note, Ginger. I'll make sure everyone has recording. So Ginger is my co-lead on this. And if anyone doesn't have recording privileges, let us both know maybe in the chat, and we will be sure to give you recording permissions. If you could keep your microphones muted as a courtesy to our broadcast journalists, as they will be capturing some sound bites. We want to avoid any background noise. If you've been on these chats before, we like to take the questions in the chat field. So at any time you can start populating that with your questions, and I will run through them with our expert. And then if we have time at the end, sometimes we allow you to unmute yourself and ask the questions directly. We have about an hour, so hopefully that will give us plenty of time to get through all the questions. And if there's any follow-ups, feel free to send them to myself or newsbureau@mayo.edu, and I'll be sure to follow up with you later with anything in addition to what's covered today. So apologize about the wait.
Kelly, do you want me to page her or anything?
Oh, she's calling me right now. Hold on.
Okay.
Okay, she'll be joining in just a minute here. Sorry about the wait. Having some technical difficulties.
If anybody does not have the ability to record at this point, please let us know in the chat.
I see you. I'm just going to put the video in a minute. I'm hearing my echo, so I'm going to turn it off.
You have no weapon. So go over to him.
All right.
There you go. Just knifing. Shiv.
We are hearing some background noise. I don't know if that's Melissa Morissette.
You can reload.
Okay, thank you. Appreciate it. All right. Well, thank you, everyone, for joining. Again, sorry about the delay. Technology sometimes just isn't in our favor. So but we have plenty of time still. And we are joined here by Dr. Priya Sampath Kumar. She's an infectious disease specialist here at Mayo Clinic. And she's going to be chatting today about influenza, the vaccine, a little bit about COVID. And so we're going to give it over to her to open us up. And then again, if you have questions, put them in the chat and I will answer those when she's finished. So Dr. Sampath Kumar, welcome, and we'll let you go ahead.
Okay, thank you so much for having me here to talk to you about the upcoming flu season and putting it in context of COVID. The COVID pandemic is still ongoing. And now we are starting to worry about what the flu season holds for us. Last year was an amazing flu season. We had almost no cases of influenza at all. And that was because we were still, all of us were so very worried about COVID, and we were using what is called COVID appropriate behavior, avoiding crowds, wearing masks when we were indoors and in crowded situations. And we were still afraid of the unknowns. And so we did have very good uptake of the influenza vaccine. So those three factors made the influenza season very, very mild. Each year, a large number of people get influenza, and then that protects them for a period of time against influenza. Last year, having been such a good season, having nobody really get very sick with influenza means that this year, more people are at risk. And so it makes it doubly important that we all get vaccinated against influenza. We have not heard of any supply issues with the flu vaccine, so we should have plenty of flu vaccine to vaccinate everyone who needs the vaccine. The flu recommendations are very simple. Everyone over the age of 6 months is eligible to get the flu vaccine. Children under the age of 9 who have not previously been vaccinated need 2 doses. Everyone else needs just 1 dose. There are multiple different types of formulations of the flu vaccine. And again, there should be plenty of supply. So I'd encourage you to get the message out that everyone needs to get the flu vaccine. As you know, children still can't get the COVID vaccine, and it's doubly important that children, therefore, get the flu vaccine. The flu vaccine does not provide any protection against COVID, but unlike COVID, which causes a relatively mild illness in children compared to adults, COVID is actually more serious in young children than in adults. So all of these, again, are really good reasons to get the flu vaccine. I hear from a lot of people that say they got influenza from the flu vaccine. Most of the influenza vaccine in the US is inactivated, and even the live flu vaccine, the nasal spray, the vaccine is so weakened the virus is so weakened in that vaccine that you can't actually get influenza from the vaccine. So really, you cannot get influenza from vaccination. Sometimes you can get some side effects from the vaccine, a low-grade fever, some muscle aches and pains that can feel like maybe you have influenza, but it's nothing like the real illness. And these are just signs that your body is responding well to the vaccine. So again, I can't emphasize again how important it is that everyone get vaccinated, especially important for people at the extremes of age, young children and the elderly.
Great, thank you for that update there. We do have some questions coming in already, so I will go ahead and read those. This is from Sarah Gannon. There's 2 questions, so I'll start with the first one. How can parents best protect their children who are too young to be vaccinated?
So this is for the flu vaccine? Is this question about the flu vaccine?
Sarah, can you confirm it? You can unmute if you need to.
Yeah, I believe it's for the flu vaccine, but if you want to double it in, also including, for kids that aren't vaccinated yet for the COVID vaccine, you can do both.
Okay. So for the flu vaccine, the children who can't be vaccinated against the flu vaccine are very young children, infants under the age of 6 months. These children can be protected still from flu by vaccinating everyone around them. So parents, grandparents, siblings, if you vaccinate them, the infant is less likely to be exposed to influenza. The other really important way to protect infants is to vaccinate the mother during pregnancy. So vaccinating the mother means that the mother develops antibodies against influenza and passes this on to the baby, and this then protects the infant for the first 6 months when the infant can't make their own antibodies in response to the vaccine. And the same thing holds true for COVID. As you know, with COVID, children under the age of 12 still can't get vaccinated. So similarly, the best way to protect them is to vaccinate all the adults in their life, from school teachers to siblings, to parents, to grandparents, uncles, aunts.
Thank you. Second question from Sarah. Some research shows kids ages 5 to 22 could get a smaller dose of the vaccine. Would age or size of the child have impact on how much of the vaccine they would get?
This is 5 to 22 years with COVID vaccine. I'm not. Would you want to mind?
Yeah, says some research shows kids ages 5 to 22 could get a smaller dose of the vaccine. Would age or size of the child have impact on how much of the vaccine they would get? I'm assuming this is flu, since it talks about ages 5 to 22. And for any future questions, if you are referring to flu or COVID, please enter that so that we get the right answers for your question. Okay, go ahead.
A quick interruption, sorry. It should be 11. I didn't mean to type 22. I meant to type 11. I'm sorry. And yes, relating to the flu vaccine. Sorry about that.
So actually, children, the flu vaccine did come in different strengths previously, with smaller antigen doses for younger children. Most of the flu vaccines for children over the age of 2 actually have the same antigen dose as the adults, because we found that there's no harm in giving them a higher antigen dose, and children's immune systems aren't as well developed as adults, so they tend to not mount as much of a response. So in the last 2 years, the antigen in the flu vaccine has actually increased for younger children. And again, we have no supply issues, so we don't need to give them a smaller antigen dose. The flu vaccine that your 3-year-old gets is identical to what a 22-year-old would get.
Okay, thank you for that. Here's a question from Marissa Voss. How much of an increased risk do people have with getting influenza with no mask mandate this year versus last year when there was a mask mandate? Are there any statistics or research?
So we have been hearing about, there are no randomized control trials on masks. Why are people recommending masks when there aren't these trials? So it's true that there are no randomized control trials where people were randomized to masks versus no masks, other than a recent study in Bangladesh where they did exactly that. And it was found that respiratory illnesses were significantly reduced in those who, the randomized villages to wear masks versus no masks, and the villages where people wore masks had much lower rates of all respiratory illnesses. So definitely masks work. So in previous years, then why did we not recommend masks as a method to reduce influenza illness? And the reason for that was really we had an effective vaccine, and we didn't want people to go through the inconvenience of wearing masks in addition to getting vaccinated. If we added masks to influenza vaccination, I think it would definitely further reduce influenza illness in community settings and healthcare settings and in schools, etc. I think that last year, with everyone being masked for the majority of the time, that was the reason why influenza illnesses were reduced. So we again had a natural experiment that showed us that masks work at preventing all these respiratory illnesses. So those are the statistics and the research that I have to offer you. This year, we have seen, and during the summer, as with higher vaccination rates, many communities relaxed masking. We saw an unusual phenomenon, and that was RSV infections. RSV infections are a type of respiratory infections that primarily affect very young children. And we've seen a big spike in that out of season. Usually the season is just like influenza, fall and winter. But this year, late summer, we started seeing a lot of RSV because people were not being masked.
Great, thank you for that. And let's talk about timing for the flu vaccine. I mean, what's the recommended start time? Like, when should people start getting their influenza vaccines? Should they be waiting or?
So September is actually a good time to start getting the flu vaccine for everybody. For very young children, children under the age of 9 need 2 doses of the vaccine. If this is the very first year that they're getting vaccinated, so they need 2 doses, and then it takes separated by 4 weeks, and then it takes an additional 2 weeks for the vaccine to provide the immunity. So you will need a 6-week interval. So for very young children, it's recommended that you start as early as July or August, as soon as the vaccine becomes available. For older people, where there's some concern that immunity wanes in 6 months or so, it's better to wait until September. But right now is prime time. Everybody who can start getting vaccinated now.
Okay. And does there need to be a certain time distance if someone's considering getting their COVID vaccine as well? If they haven't been vaccinated for that, do they have to wait any, time frame between getting both of them?
Yeah, so the really good news is that you can get the COVID vaccine and the influenza vaccine at the same time, cutting down, your travel time to make an appointment, etc. So you can get both at the same time. And this is especially important if you are in one of those categories that qualifies for a 3rd dose of the COVID vaccine. When you go in to get that, you can ask if they have the flu vaccine and get it at that very same visit.
Great. Thank you. Here's a question from Madeline Watson. When children get the flu, would the symptoms be similar / more severe than when they are diagnosed with COVID-19? With the Delta variant proving to be more contagious, is it more contagious than influenza in kids?
So we know that COVID in general is more contagious than influenza. So we think that the same will hold in adults. So we think the same thing will hold true for children also. The symptoms, the first part of your question was about symptoms, and that is almost impossible to distinguish COVID and influenza. So young children generally have mild COVID, and they generally have severe influenza. So both of those can really present in identical ways. It starts out with a runny nose. Children can complain of feeling tired, just like adults do. They can have a cough, and really you cannot tell one respiratory virus from another without a test. So testing is very important to distinguish the two. Both viruses are kind of spread in a similar manner from being in close contact with people who are who have the virus in their upper airways. So masking and cleaning your hands frequently are both measures that will protect you from both viruses. But to distinguish, there's nothing characteristic that distinguishes one from another. The only thing that might be a clue is in influenza, you don't get the loss of smell and taste without a stuffy nose. In COVID, you can lose your sense of smell even if your nose is not blocked. So if that is there, it's more likely to be COVID, but again, there's no other clear distinguishing factor.
Okay, thanks. And does the flu vaccine help against COVID? I'm also thinking about, kids who aren't old enough to get a COVID vaccine.
So there's absolutely no cross-reactivity between influenza and COVID. So the flu vaccine will not prevent you from getting COVID. The flu vaccine could make you less likely to get flu, less likely to be sick, and therefore less likely to contract another infection. So in that way, it can help. But directly, there's no protection from the COVID vaccine between the influenza vaccine and the COVID vaccine. There's no cross protection.
Okay. And we're hearing a lot about immunosuppressed, immunocompromised individuals. How does the flu vaccine protect? I mean, is it important for those individuals also to get a flu vaccine just as well as a COVID vaccine?
Yes. So the people who are at high risk of complications from influenza and the people who are at high risk of complications from COVID are very similar. So older people, people who have some underlying medical conditions like asthma, like diabetes, people who are overweight or obese, and then people who have weakened immune systems are all at high risk for complications from both of these infections. So for both, so it's important that these individuals get protected with both the COVID vaccine and the influenza vaccine.
Great, thank you. I have a question from a reporter with WKBT. Are there concerns that the COVID opposition might spread to the influenza vaccines? What impact could that have?
Yes, there is concern that the whole anti-COVID vaccine movement could spread to all vaccines. We've been seeing a rise in anti-vaxxers over the last few years, even before COVID. With COVID, some of the anti-vaxxers had more ammunition because they said the vaccine is new, the vaccine hasn't been tested as rigorously as other vaccines. The influenza vaccine has been around since the 1940s, so I'm hoping it's possible that, again, that the opposition might spread to influenza vaccines, but the fact that the flu vaccines have such a long track record of safety, I'm hoping will mean that not as many people are opposed to the influenza vaccines.
Great, thank you. All right, kind of at the end of some of the questions that have come in. Journalists, if you have some additional questions, feel free to put them in the chat here. Wait just a moment. I guess we could talk about masks and how that, I mean, you've already touched on it a little bit, but how does that really impact or, help the spread of influenza in public settings, even coming up to some holidays and things like that? What are some tips for people or information you can share?
So, like I said, masks sort of act like source control. So if you were sick and you wear a mask, the risk of you spreading any kind of respiratory virus to others is reduced significantly. The masks also protect the wearer. If someone around them is sick, it protects the wearer from getting those respiratory viruses. So the masks do a lot of good in source control, but also some good in preventing exposure of the wearer to respiratory viruses. And I think that in many parts of Asia, where flu is not seasonal like it is in the US, flu circulates year round. Many people wear masks all year when they're in crowded situations. So in airports, you'll often see people wearing masks all the time. When they're outdoors, they take the mask off. When they move indoors, they put the mask on. And so I think those are things that will help us. They're inconvenient. Nobody wants to be wearing a mask the whole time, so we don't do it. But if you're able to do it, yes, it's definitely one way to protect yourself and to protect everyone around you. So the thing about influenza, the other thing is staying home when you're sick, of course, but just like COVID, you can be infectious with influenza for 24 hours prior to the onset of symptoms. So that's why influenza can spread very easily, because you're spreading it before you actually know that you yourself are infected. And that's why vaccination is so important. And if for some reason you can't access vaccination, you can wear a mask.
Thank you. Let's talk about testing. So if a person has flu-like symptoms, should they get tested for both the flu and COVID? And does that happen automatically, or do they need to request one or the other? Or how, kind of explain that?
Yes. So like I said, there's no good way based on symptoms to tell the difference between the two. And so during flu season, which we think of it as probably sometime between November and at the end of March in most parts of the country. Some places flu starts earlier, and some places flu continues later. For instance, in Minnesota, some years we've seen flu circulate as late as May. So, but when flu is circulating in the community, it's important that if you have respiratory symptoms, you get tested for both. And depending on where you live, it might be automatic, or you might have to ask for it. In Olmsted County, when influenza cases are noticed, we automatically test anyone presenting for COVID testing for both viruses. And we actually also test for RSV with the same swab. So in some parts of the country, it might be automatic. In other parts, you might have to request. So when you go in for testing with respiratory symptoms, you can ask what exactly they're testing for. In certain groups of individuals, typically young children with sore throats, we would also test for group-based strep, which also presents in a very similar manner with sore throat and runny nose.
Okay, thank you. Here's a question from Kaya Edwards. If you do get a COVID booster and a flu shot on the same day, would symptoms and reactions to the vaccinations be more intense?
We don't know because we haven't done that before, so we'll have to wait and see. If you are getting the the COVID booster, which is really the third dose of the COVID vaccine, from what we've seen, most people are not having as intense symptoms as they did with the first dose and the second dose of the vaccine. So it's really not very severe reactions. And if they've had flu vaccines before, then again, most people don't have very severe reactions. So hopefully, altogether, most people will have tolerable reactions, but I don't specifically know the answer to will COVID and flu on the same day give you more reactions, because we haven't done it yet.
Okay, great, thank you. I have a couple of questions on how long the vaccine will last in regards to protection. Like when does the period end for being protected if you get it in September?
For most people, the vaccine protects you for somewhere around 8 months. So well through into the flu season. In the very elderly or the very immunosuppressed, that period of protection might be somewhat shorter at about 6 months. And that's why we say September will get you through about March or April. The protection varies depending on how good your immune system is.
Mm-hmm. Okay. We have another question about, this might have been touched already, but is there an age group in particular you're expecting a serious uptick in cases?
So it would depend on which age groups don't get vaccinated. So that's what really makes the big difference. So in past seasons, most of the elderly, most people with underlying conditions do come forward to get the flu vaccine. And so it's really younger people who think I don't really need the flu vaccine who don't get it. And that's, again, they're also the people most likely to be going out to work, to school. Excuse me. That would be the group where we would be most worried about an uptick in flu.
Okay, thank you. We have a question from Rudy Cavazos. In Arizona, influenza vaccination rates are among the lowest nationwide. Are there any methods or steps communities can take to reduce vaccine hesitancy?
So with flu, it's I think part of it is that we don't get the word out that everyone needs the flu vaccine. We again have this misconception that the flu vaccine is really for the elderly or those with weakened immune systems. I think that we could improve flu vaccine rates by emphasizing that everyone benefits from getting the flu vaccine. And then the second thing we can do is make it extremely easy to get the flu vaccine. So having drop-in places where you can get it, having it available in grocery stores, you're doing a grocery run or running out to get bread and milk, you can get your flu vaccine there. The other thing that works really well is school-based clinics. So everyone goes to school, and if kids can get the vaccine in school without parents having to pull them out of school, take them in for a visit to a doctor's office, that can be very effective at increasing vaccination rates. And so by that extension, making it available in colleges, in public libraries, increasing access, I think, would improve flu vaccination rates.
Great, thank you. Another question from Madeline Watson. People can be asymptomatic with COVID. What about with the flu?
Yes, so people can be completely asymptomatic with COVID, never know they had it, and the same thing can happen with influenza. There's also the pre-symptomatic phase, so people who do get symptoms with COVID are infectious for 48 hours before the onset of symptoms. With the influenza, it's about 24 hours prior to the onset of symptoms, and these are, rough figures. That's roughly the time range. So just like COVID, you can be infectious before you have symptoms, or you can have a completely asymptomatic infection and spread it to others.
Okay, thank you. Just going through my questions here. I have another one here. So we talked about masking as a protective measure, but what are some other ways that people can protect themselves from contacting the flu this fall or winter season?
Masking is really important. The other one is just the same things we talk about for COVID, social distancing. If you can keep your distance from people, not go into really crowded places where people places where large numbers of people gather, that can be protective. And then hand hygiene. We know that influenza does spread through contact, indirect contact. If someone coughed or sneezed like I just did, and leaves their virus on surfaces, then you can touch that surface, touch your face or mouth, and then transmit to your acquire infection yourself. So those are the ways that, hand hygiene, distancing, masking, those are the ways you can prevent both COVID and influenza.
Okay, thank you. And speaking about both of them, last year doctors said they were worried about hospital capacity if a twindemic of the flu and COVID hit. Considering the recent rise in COVID cases across the US and the fact that we have fewer mask mandates this fall, are you concerned about hospital capacity if we get a typical flu season this winter?
Yes, absolutely. So right now, without influenza, hospitals are already really strained in different parts of the country. And you need the same kinds of resources for both influenza and COVID. You need medical ICUs, you need ventilators, you need oxygen, you need the same kind of personnel, respiratory therapists, ICU nurses, intensivists to take care of people with severe influenza and take care of people with COVID. So we're definitely very worried, and that's why we're doing this, talking about flu vaccine, hoping to avert this twindemic.
Yeah, very important. All right. And through all the questions in the chat media, so continue to put them in the chat, or at this time, if you needed to unmute yourself and ask, feel free to do that as well. But I also just got another question. What should families do to protect the rest of the household if one person gets influenza?
So exactly the same kinds of things you would do for COVID. The person who has influenza should be isolated in a room by themselves if possible. They should cover their nose and mouth when they come out of that space where they're being isolated. The isolation for influenza is we typically recommend isolating the person for about 24 hours after their fever resolves. So it would depend on how bad the illness is, how long they are sick. When you have contact with that person, washing your hands or using hand sanitizer after that, wearing a mask around them will protect other members of the family. And then getting the flu vaccine isn't going to protect you right away because it takes 2 weeks to develop protection. But again, it's a good reminder to get the flu vaccine if you haven't already. The other point I do want to make is you can actually get influenza more than once during the flu season. There are so a question that no one has asked is if I have influenza in December, should I still get the flu shot? So the flu vaccines have 4 strains of influenza, 2 influenza A and 2 influenza B strains. And these different strains circulate at different times during the flu season. So even if you had influenza, that's why we still recommend the flu shot, because you're still not protected against the other strains that can circulate later on in the season.
Great. And speaking of that, a question just came in about people who tend to procrastinate. And so when was the latest they should get their flu shot? I mean, if they wait.
The flu vaccines all expire in June. So until they expire, you can go ahead and get the flu vaccine. Like I said, flu activity is most prominent between about November and March, but different parts of the country, it's different. So if flu is still circulating in your community, it is a good idea to go ahead and get vaccinated, even if it's April or May.
Okay, good. And for people who do get influenza, I mean, what are some home remedies or things to ease symptoms?
Just Tylenol for symptoms. If you have a headache, if you have a lot of body aches, Tylenol can help with that. Rest is really important because people who have had bad influenza tell me that they feel like they've been hit by a truck. So getting some rest. Drinking plenty of fluids would help. Chicken noodle soup never hurt anyone, so that would be something to consider. And staying away from people and not infecting other people.
Okay, good. And we touched on the twindemic already. This is the second year. Do you think this double threat will be something that we are going to see going forward each year?
So I think that at some point in time, and I don't know when, COVID will become like influenza, something that flares up periodically, maybe seasonally, just like influenza does. So I think that, again, you've probably heard that different companies are trying to make combination vaccines that would protect you against several different respiratory viruses. So I think that we will have the option to protect ourselves against multiple viruses with one shot, and that it will be the way we deal with these pandemics in the future. Influenza, there's a lot of interest in an RSV vaccine also, because RSV causes a lot of illness in children and in the immunosuppressed and the elderly. Mm-hmm. So hopefully we'll have vaccines that can protect us against all of these, and that we can take, instead of having multiple different shots, we can get it all combined into one.
Yeah, thank you. If someone does have influenza, when should they seek medical attention?
So fortunately for most young, healthy individuals, influenza is generally mild, and taking these home remedies and getting some rest is all that you need. If you have very high fever, if you have any difficulty with breathing, those are things that should make you seek medical attention. If you're in a very high-risk group for complications of influenza, that would be another time you might reach out to a medical professional and ask if you should come in. Those would be the elderly, people with suppressed immune systems, and the other group that is at high risk for complications from influenza is pregnant women. So these are the groups that, you might have a lower bar for seeking medical attention.
Right.
There are antivirals and that can help treat influenza. They only work if they're started fairly early in the course of the illness, so within the first 48 hours of symptoms. So if you have the ability to call a medical professional and get the medication prescribed, you can start taking the medication quickly.
And do you need a positive flu test before that's administered?
It depends on the time of this the illness. So very early and very late in the flu season, we would want to confirm that indeed that is the diagnosis. During the when flu cases are in full swing, and most people have influenza unless proven otherwise, we might still recommend testing, especially this year because it could be COVID. But we would not hold back the prescription. We would say you can go ahead and get started while waiting for the test result.
Okay. Another question about climate. Does climate matter in the spread of the flu? For instance, an environment such as Phoenix versus the winter in the Midwest?
So some things about flu that make it unique and that make it worse in places like the Midwest is that the virus actually lasts longer on surfaces when you have in colder temperatures and in low humidity. So I know they talk about dry heat, so I don't know if the temperature and the humidity cancel each other out. But in Minnesota, for instance, we have both the cold weather and very low humidity in winter. And that actually allows the virus to propagate and enhances its ability to survive. So that's why we have a flu season. In tropical countries, there is no flu season. Flu circulates year round because there's really no major temperature shifts. So humidity isn't the only thing. So places like Florida still have bad flu seasons, but we have more cases of influenza in places with weather like Minnesota.
Thank you. All right. Well, journalists, if you want to unmute yourselves and ask any additional questions, feel free to do that at this time. Otherwise, I'll give you some time back here. We'll just wait a moment here. All right. It's quiet. So if we have all the questions answered, is there anything else you want to just add at the end here?
I hope everybody on this call has had their COVID vaccine and that you're going to get your flu vaccine this year.
All right, great. Good way to stop spreading illnesses. So, well, thank you, Dr. Sampath Kumar, for your time. Thank you to the journalists for joining. And again, if you have any follow-up questions, email me at newsbureau@mayo.edu. And we'll also have a recording of this segment up on our Mayo Clinic News Network later this afternoon. So you can check back there too if you need some additional sound bites. So, all right, well, thank you so much. Have a good day.